Hello everyone. Today we will be discussing some of the multiple choice questions based on oral contraceptive pills. Last time we took a grand discussion on oral contraceptive pills and I hope all of you have liked it. They are very simple questions, but today I want to discuss them to tell you first of all to recheck that whether we have understood oral contraceptive pills or not, number one, and number two, to see how to approach MCQs in exams. First question, first read what does it say. The primary mechanism of action of combined oral contraceptive pills is. Many words are important in your question. The primary word important and combined pills important. So what the examiner wants to know that first of all, do you know what is a combined pill and what is the main mechanism of action? So first one says prevention of implantation. Second one says inhibition of ovulation, thickening of cervical mucus only and alteration of tubal motility. So if we go back to our lecture, all four of them are mentioned as mechanism of action of combined pills, but there is an order. Primary mechanism is this, most important. I have earmarked in my lecture also that the main mechanism of action of combined oral contraceptive pills is inhibition of ovulation, and rest of them are there but they are secondary. So mainly it inhibits ovulation by inhibiting the FSH and LH interplay. Next, which hormone combination is present in combined pills? Very easy question, but hormone combination and combined pill. So the examiner wants to evaluate about combined pill. So whether it is E plus P or estrogen plus testosterone or only progesterone or only estrogen. So the answer is A, estrogen plus progesterone, and according to the type of progesterone we decide the generation of the pill. The estrogen component most commonly used in OC pill, most commonly. All of these questions I have already covered in my OC pills lecture, but it is just the exam point of view. So estradiol valerate, yes, we have in newer 4th generation pills, we have got estradiol valerate, but it is not the most common. Conjugated estrogen, no. Ethinyl estradiol, yes. So your answer is ethinyl estradiol. Which of the following is an absolute contraindication? Important, absolute. Remember that MEC chart, absolute contraindication to COCs. Diabetes mellitus, no, it is not an absolute contraindication. Migraine without aura, migraine with aura is a contraindication. History of DVT, yes, it is an absolute contraindication. I have told at that time also, any hormonal preparation, especially those containing estrogen, any history of venous thromboembolism is a big no-no. And iron deficiency anemia, no, it improves iron deficiency anemia. So our answer is C, history of DVT. The most common side effect of OC pills, most common side effect. Question is not asking most dreaded, it is asking most common. Most common is what we see in every other patient. Weight gain, yes, it happens, but not to that extent. Nausea, yes, it is very common. Every other patient in initial cycles will complain of nausea. Hypertension, yes, it can, but in relatively less common condition, and breast cancer also. So when we go for most common, then it will be nausea. Which oral contraceptive is preferred during lactation? This also we covered in our lecture. We generally don't want to give estrogen. So the answer is combined OC pills, no. It can be given in certain condition, but generally we avoid. High dose estrogen pill, absolutely no. Progesterone only pill, yes, I have told. For example, Cerazette, right? We are giving POPs in lactating mothers. Next, missed pills. We were talking about missed pills. Remember that if she forgets one pill, what will happen? 2 pills, then what will happen? Missed pills increase the risk of failure, mainly due to, what is the cause of that failure? Increased estrogen levels? No. Breakthrough bleeding. What is breakthrough bleeding? Breakthrough bleeding is that small spotting which occurs even on pills. So the definition itself says that the patient is taking pills. So breakthrough bleeding, no. Escape ovulation, yes. If she misses 2 pills continuously, she can ovulate. Reduced intestinal absorption, no. So the answer is escape ovulation. Pearl index is used to measure. What is Pearl index? Pearl index is the failure rate of a contraceptive. It is the number of accidental pregnancies per 100 women year. That means over a given span of time, what is the number of pregnancies that would occur. So according to the definition, what it measures? It measures the failure rate of a given contraceptive. So Pearl index is used to measure cost effectiveness of contraceptive method. Cost has nothing to do with Pearl index. Side effects? No. Efficacy? Yes, because we derive failure rate. So failure rate itself shows you the efficacy. More efficacy, less failure rate. So efficacy of a contraceptive method. And compliance? No. So our answer is efficacy of a contraceptive method. Which of the following is a non-contraceptive benefit of OCPs that we have discussed in our lecture? OCPs, yes, it is a contraceptive. Contraception is the main work, main job. But what other benefits we derive? Increased risk of ovarian cancer. As the thing itself say, increased risk. It is never a benefit. In fact, it decreases the risk. So, no. Increased menstrual blood loss? No. We know it decreases the menstrual blood loss. Reduced risk of endometrial cancer? Yes, it decreases the risk of endometrial cancer. We have studied this. And increased risk of cervical cancer is not a benefit, it is a loss. Which of the following drugs reduce the efficacy of combined pills by enzyme induction? This we have talked about. Enzyme inducers, generally we don't give OCPs when the patient is taking that drug which decreases the efficacy. Erythromycin, no. Rifampicin, yes. So any patient who is on AKT having rifampicin which induces the enzyme which increases the metabolic rate for OCPs and decreases the efficacy. We generally don't prescribe OCPs in a patient who is taking rifampicin. So your answer is rifampicin. With this, I finish off this small talk about how to attempt MCQs of any topic. OCPs, because recently we have studied OCPs, and this is how we always go for MCQs. Thank you.